Hi, and welcome to another mental health lesson on this channel. I believe that you find today's topic useful. We are looking at the topic compassion fatigue. Compassion fatigue. And I'm sure someone would be asking, how can you put compassion and fatigue in one breath or in one statement, so to speak? Um, we know compassion to be a certain character of love, of concern, and being there for people, feeling the pain of others. So people feeling as compassion. So when we say that we are compassionate, it is a good trait. It is something that is positive and helpful. But in showing compassion, there are times where we get fatigued, and we'll discuss what that means in today's lesson. And I hope that you'd find it useful, and I hope that it will help any of us that may be going through compassion fatigue at this particular moment. So your battery may be down when it comes to how you are able to sustain your compassion, whether as a professional or just as someone who shows care and love to others. So we'll begin with a case for reflection, a case that we want to reflect on. And as I was preparing for this particular video, um, I came across this case from procall.org, and I felt it is a useful case to use in trying to understand the concept of compassion fatigue and what we can do. So the case is about hypothesized Fatima, who is a 50-year-old nurse who works within an oncology department. Oncology is about studying and understanding cancer and trauma related issues and how to treat them. So she was a nurse who was working primarily with trauma patients and issues of cancer and all. Approximately 15 years ago, that is when she was around 35, Fatima went through a period of feeling fatigued, tired, lacked motivation, and had difficulty finding meaning in her work. At the time, she was working very long hours for the day, for the week, with a heavy caseload of patients and did not feel supported by her colleagues and supervisor. She experienced low mood, was more irritable with her children and spouse, and found it difficult to experience pleasure in the leisure activities she used to enjoy. Now, with the help of a mental health counselor and engaging in counseling, Fatima realized that she was experiencing burnout, symptoms of compassion fatigue, which is our focus for today. So, just like many of us who probably work in areas of nursing, medicine, counseling, psychology, mental health, and all that, we can share in the experience of Fatima, of how sometimes the load of work on you as you are dealing with patients, as you are dealing with clients, can begin to take a toll on you. So the work you do in itself, where you are a compassionate, individual, professional, may bring some satisfaction to you, especially if you're able to help a patient or a client come out of their issue. If you're a counselor, a psychologist, working with a client who is finally able to get back to a sound state of well-being, you're a doctor, you're a nurse, and the patient gets better. It brings us some satisfaction, what we call compassion satisfaction. However, as we get along, sometimes when the patients are getting more and more, the cases you are having to deal with as a psychologist, as a counselor, as a mental health professional, or whoever it is, a foster carer, a parent, a friend to someone who is going through trauma, it begins to take a toll on us, and we begin to feel fatigued. And just like Fatima, we begin to lack motivation and have a lot of difficulty juggling the whole work that we are engaged in. So we want to explore what compassion fatigue is, which is different from burnout. Burnout may lead to compassion fatigue. So where you feel you are become overwhelmed, with so much work, so much thoughts, thinking, and so much workload and all that. So at a point, you begin to feel like you are out of energy, out of strength to proceed. And there's a lesson I did on mental fatigue that could be something that you want to look at. And it could give you some understanding of how sometimes working and having so much in terms of cognitive workload can be very negative to us. So, what is compassion fatigue? According to Dr. Charles Figley, who primarily came up with that coining of compassion fatigue. Compassion fatigue is a state experienced by those helping people or animals in distress. It is an extreme state of tension and preoccupation with the suffering of those being helped to the degree that it can create a secondary traumatic stress for the helper. So compassion fatigue is experienced by, so these are the key things I highlight in the red: helping people or animals in distress. The key is distress. So helping people or animals who are in distress, which brings about a certain experience of tension and you know uh, certain concern that begins to take a toll on you, and you can experience what is called uh, secondary traumatic stress, which is also referred to as the compassion fatigue. And the care that you are given, if you have a pet who has had an accident or has fallen ill, and you are someone who loves animals, you love cats, you love dogs, it gets to a point where probably this dog or cat dies, and it can take a toll on such persons who have so much love and care for animals. And so, if you are someone who is an onlooker, you may not understand what is happening to this person to have them, going through all the um, trauma they are experiencing. It is a secondary trauma, that they're experiencing because of the pain that the animal is going through. And same is when it comes to, human beings, our fellows, a parent dealing with a child who has particular disability, or has had an accident, or has had something happen to them, a traumatic experience. So the parents begin to feel the burden, that gets overwhelming over time. Although in caring for the child, in doing your best, you are doing something that shows forth compassion, and in itself it is satisfying because you are helping. It can get to a point where caring becomes unbearable. It becomes a burden that you wish you could just let go of. Not that you do not love the person again, not that you do not care again, but you have become so overwhelmed that you begin to experience what we call compassion fatigue. So when the demands, so psychological demands, physical demands, emotional demands of the people we care for begins to affect our personal living, our day-to-day activities, as we'll see in the case of Fatima, you realize that she began to have a lot of issues with her children and her spouse, very, very intolerant, because there was so much load on her, and so very irritable, and she had difficulty even having leisure for herself. Activities she used to enjoy, probably going out with friends, watching a movie and all that, became something that she struggled to enjoy. So when the demands of the ones we care for begins to affect our personal living, then we may be experiencing compassion fatigue. And compassion fatigue is also referred to as vicarious trauma. Vicarious means that it's from observation, it's from having an experience. You are not directly the one going through the pain. You are not the one that is suffering the trauma, but you get to suffer similar symptoms as the primary person just because you are engaged with them. So in learning, when we say vicarious learning, it's learning by observation. So compassion fatigue is also referred to as vicarious trauma, compassion stress, or secondary traumatic stress. And there's a disorder that is similar to what we call post-traumatic stress disorder. And this is referred to as secondary traumatic stress disorder, STSD. So you'd find, and that's not the focus of today's lesson, but you find that individuals that are going through PTSD have similar symptoms as those going through STSD. And as we mentioned from the beginning, compassion fatigue is usually associated with people who work in the helping professions. So foster carers, those who work in foster homes, work with persons with exceptional abilities, uh, nurses, counselors, social workers, psychologists, um, or any other person who is very caring. So parents, siblings, or anybody, as we mentioned, who has a certain love for pets and all that. So it is associated with people that care, and it's not care just any kind of caring. People that are compassionate, and the kind of caring that they care, can be so so high that it sometimes has an effect on them uh, regarding compassion fatigue. And as I mentioned earlier, the symptoms of compassion fatigue are similar to those related to post-traumatic stress disorder. So someone who is going through compassion fatigue will be experiencing some symptoms that are similar to PTSD. And at the end of the day, without it being checked, they may end up, with a secondary traumatic stress disorder. So it's important that we understand this whole thing about compassion fatigue and take it serious, and it will really help us. What are the causes of compassion fatigue? Generally, as we've mentioned before, when you work with traumatized or distressed individuals for a prolonged time, you will um, or you may experience compassion fatigue. So back to the case of Fatima. So she had been working in the oncology department dealing with trauma cases, patients who have had accidents, patients who a lot of trauma, cancer and all that. So and she had been doing that for a long time, and there were other factors that were more or less perpetuating a case of compassion fatigue. The fact that long working hours, she felt her colleagues were not really helping, her supervisor was not also so much on deck to offer her the needed assistance and all that. So we find that individuals who work with traumatized or distressed individuals, that could be a risk factor for you to experience compassion fatigue. Caring for family members who are incapacitated, so those who have had a physical accident, a physical injury that has made them incapacitated as a result, a chronic disease or illness that makes this person go through a lot of pain, and you are up the hospital here and there caring for them, doing almost everything for them. It can be a risk factor or a reason why you would or may end up experiencing compassion fatigue. Then consistently witnessing the suffering and pain of other people. So if you are someone who probably works in an area where you are dealing with the accident reports and seeing a lot of accident cases, probably where you live, a lot of accidents happen, and you are almost always experiencing or being a witness to accidents. So all of that trauma uh, begins to take a toll on you. and the flashbacks and all that could lead you to getting compassion fatigue, particularly if you are someone who really empathizes with people and cares for the well-being of people. So consistently witnessing the suffering and pain of others, be it your friend or your child or your parents, old parents, and all that, could be a risk factor for compassion fatigue. And so these are generally the three key things I would want us to pay attention to when it comes to the causes or risk factors for compassion fatigue. Other factors can, come in to more or less moderate or mediate how these causes would at the end of the day affect you. So someone may be working with traumatized patients for a longer time, but because they have the right supervision to fall on, they have a good support system around them, it minimizes the chances of them experiencing compassion fatigue. So there are factors that can, moderate how this whole experience comes on. What are the symptoms of compassion fatigue? Some of the symptoms of compassion fatigue: increased feelings of sadness and worthlessness. It gets to a point where sometimes, just because of uh, the energy, the financial investment into the person you are caring for, particularly if it's your child or your parent, the demands that it places on you, um, at some point you just wish that they would get better, but it keeps getting worse. If you are not careful, you begin to experience depressive symptoms. And one of the key things when it comes to depression is a sense of worthlessness, that life is not worth living, and all that. And a lot of sad moments, a lot of crying happening. So increased feelings of sadness and worthlessness, which are symptoms of depression, are associated with compassion fatigue. An increased withdrawal and isolation. So in the case of Fatima, you realize that she became irritable. So with the children and the spouse, that tells you that it would even be worse probably with other people that are long distance, friends or relatives. So the people want to withdraw. You want to withdraw. You want to be alone. You don't want anybody to disturb you, because processing the whole trauma that you are vicariously experiencing is a whole load on you, and the fatigue associated with that mental processing and the toll it takes on you. You just want to have your own time alone. You don't want anybody to disturb you, even as you go through those moments of reflection on the pain you are going through as a carer and all. So increased withdrawal and isolation as a result of the fatigue being experienced as a carer. Increased neglect of self-care and self-time. And that is because, especially if you are dealing with someone who has a chronic condition and you are the one who is more or less their primary carer, it takes a lot of your time and a lot of things concerning you. Having your me time, your me time, becomes very, very difficult. So if you are not careful, you'll not be able to spend time for yourself and on yourself, your mental well-being, your physical well-being, your emotional well-being. You lose a lot of relationships because it affects your interpersonal time that you have for social experience. So increased neglect of self-care and self-time is as a result of compassion fatigue. Increased levels of anxiety, hypersensitivity, and irritability, which we see in the case of Fatima. And issues of anxiety are very, very serious. The stress that people go through, uh, carers, whether as professionals or just individuals who are in care of others who are in distress or going through trauma, is so high that the stress could be leading to cases of anxiety, and your tolerance level for stress becomes reduced. So anything, any little thing, any little illness or comment or something, gets to you, and it takes a toll on you. So individuals who are experiencing compassion fatigue may experience a lot of, anxiety, hypersensitivity, and irritability, increased problems with sleep. And this is usually an issue when it comes to stress and, I mean, chronic stress and related conditions. So, compassion fatigue would lead to a lot of problems with sleep. So, if you're experiencing these issues of having a lot of nightmares and bad dreams, probably the accidents, and you see the person that you are caring for probably dying or something, all the nightmares that are associated with um, being a carer to someone who is going through trauma or has experienced some chronic illness. It gets difficult to make time to sleep. The physical exertion, the mental exertion of effort in caring, in showing compassion, in demonstrating empathy is so much. You may have issues sleeping, insomnia, difficulties falling asleep and maintaining sleep. Um, there are increased problems with interpersonal relationships, as we see in the case of Fatima and her children, and the spouse. It's, as I mentioned, it affects your relationship with others. Um, Not necessarily because you plan it to be so, but just the whole experience, the stress, the distress you are going through. That's why it's also called the secondary stress. What's the name? Yeah, so a secondary stress, secondary traumatic stress. So you have problems in your interpersonal relationships at work, at home, and all that. And some people, in attempting to help themselves get over the problem, get over the pain they are experiencing as a carer, resorts to taking in drugs, substances, more like to help them get over the 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 thoughts that keep racing. So someone will resort to alcohol, others will take in hard drugs, as a way of helping them to cope, which is negative. And over time, you may become addicted to substances and probably end up with some substance use disorders, self-medication, and all. There's a lot of headaches that a person may be having, and so people typically would want to be getting painkillers and all that, migraine headaches here and there, which just a little rest could have cured. But you have even problems with sleep, so people will resort to self-medication as a way of helping them. And in connection with issues of anxiety, hypersensitivity, and irritability, we talk about lowered stress tolerance. And once your stress tolerance is low, it's easier for you to enter into uh, depression, anxiety, and have other diseases easily affecting you. So stress is implicated in a number of medical conditions, including cardiovascular um, diseases, headaches, a host of them. So if you have a lower stress tolerance as a result of compassion fatigue, then you are likely opening yourself up to many complications when it comes to your health. So what can we do? These are two images or quotes I usually put on my WhatsApp status, and they are reminders to myself. And anytime I'm getting so much engrossed in in my care and compassion for other people, and in the mental health space, and generally as somebody who you know is very caring and is concerned about people's well-being and all that, it can get to you sometimes. And so these are reminders for me. And one of them is to take care of yourself. Very important. Take care of yourself. And remember to take care of yourself, because you can't pour from an empty cup. You can only give what you have. So if at the end of the day, caring for someone, the care rather than leading to what we call compassion satisfaction, because in caring for others, in showing support to others, in itself it's a positive venture. And so compassion satisfaction is associated with caring, but the negative bit is where because of your caring, because of your compassion for others and taking care of them, dealing with distressed, traumatized uh, individuals, you begin to have your own health deteriorating, your mental health being damaged. Then there's no point in caring, because at the end of the day, the person you are caring from may end up receiving that negative energy from you rather than the positive energy that should be exuded from you as a carer. So these are important. Take care of yourself. Remember to always take care of yourself. And how do you do that? We talk about 6 key things that you can do. Number one, recognize that your empathetic and sympathetic tanks can become full. One thing that, as individuals who are compassionate, as individuals that are sensitive to the pain of others, and probably as a professional or just any other person, is that we fail to remind ourselves that we are only human. And so sometimes we are engrossed in the hours of work, hours of listening and all that to people. And you are in the hospital, up, down, up, down. We fail to remember that our tanks of empathy and sympathy can become full. And if those tanks are full and we do not close the tap, will end up having an overflow of the negative impact that compassion or empathy can bring to us. It's a fulfilling experience when you can share in other people's pain and then they get better. But at the end of the day, you want to remember that you are only human and you can only go as far. If you fail to accept that reality, you signing off to a lot of fatigue, a lot of secondary traumatic stress. So empathy is different from sympathy. People that are empathetic are more likely to experience secondary trauma, because empathy is about trying to fit yourself in the world of the one who is suffering. And that is why it's vicarious trauma, because you fit yourself in the pain of the one who is actually going through the trauma and the pain. And because you are empathetic and you can fit yourself in the world of the sufferer, it's like you are technically feeling the pain they are going through. Sympathy is more or less saying that I see what you are going through and it's something that I wish you were not going through. But in sympathizing, you are just more or less telling the person that it will be fine. It's you are going through pain. But in empathy, which is something that we use in the helping professions, you try to fit yourself, as people would say, in the shoes of the other person. And empathy is really necessary in the work of someone who is a helper. And if you recognize the fact that this your empathetic tank can become full, so you need to pay attention to that tank and make sure that at least it is always in a balance, such that you can also empathize with yourself. In empathizing with others, it would really help you. And you want to take on what you can handle. So before we go, we'll look at what Fatima did and see how we can fit it into all this that we discussed. Take on what you can handle. Being self-aware is important for your mental health. For a sound mental health, you should know what you can take. And that goes back to recognizing how much your tank of empathy can become full. So if you know that the workload I can handle is this, the number of patients and the issues that they have, the amount of trauma you are dealing with is becoming overwhelming, You should be able to recognize that you are at that point where you have gone beyond what you can handle. And so you need to seek help, whether from a colleague, a professional counselor, or psychologist. Knowing that point where you have gotten to your limit is very important. So take on what you can handle, and you can only take on what you can handle if you are self-aware. You know your strengths, you know your limits, you know your capacities. Very important. Very important. And number three, take care of yourself as you also care for others. So be there for yourself. So as you are making time to prepare the food for the other person, make sure you are also taking in something. You are also eating. Sometimes we care so much for others in pain that at the end of the day, we lose ourselves. And if you lose yourself, you remember that the person you are caring for will suffer the consequence, because the one who is there for them has lost themselves. They are no longer, strong enough to care. They have lost probably a good job they were in because they weren't able to pay attention to their job again. So you want to be able to make time for yourself, assess the situation, and be sure that even as you are caring for the other person, you are taking care of yourself. You are making sure that you are having the rest that you need. If it means that getting someone else to come in for you, if you're a professional, the workload is so much. Can you make some referrals? Can you speak to um, another senior professional who could be of help? Make sure that you are putting in steps that will ensure that you have time for yourself and you are taking care of yourself. You are eating right, you are exercising right, you are making time to meet friends, discussing issues with your spouse, with your children, making time for watching the television, listening to music, watching a movie, reading a book. Make sure that you are there for yourself as well. Very important. It's difficult, particularly if you are handling a child or a parent who, needs all the time and all the attention. It's difficult. In the professional world, you may be able to, run shifts here and there, but in other cases, it's quite difficult. But you want to make sure that even as you are caring, you are refilling your tank, uh, you know, uh, your tank with the strength that is needed, the diets that you are feeding on, the nutrients that you need to be stronger, making sure that you are engaged in all of these activities that are necessary for a sound physical and mental health. Be there for you. Be there for you. Make time for you. And making time for you also means that anytime you feel sick, you also make time to go to the hospital. If you feel you need someone to talk to, a professional counselor or whoever, you make time to do that. You are caring for yourself so that you have enough strength, enough energy, enough positivity to be able to show proper compassion and empathy to the one you are caring for. Number four, you want to practice mindfulness and also use other deep breathing exercises. You can search online on YouTube, any other place for some of these deep breathing exercises. The deep breathing exercises are exercises that you do to control your breath, and it helps you to know when you are under stress and how your breathing goes uh, in an improportionate balance. So in deep breathing exercises, you have one hand on the tummy, and you try breathing in deeply as your tummy comes out and out. There are a number of things that you can do in that. Probably in a different lesson, I'll do something on deep breathing. But there are a lot of deep breathing exercises online that you can find. Mindfulness is something I talked about in the lesson on CBT techniques for handling stress. Mindful living, very important. Mindfulness is any activity or a way of life that keeps you in the present moment. So if you are a mindful hearer, in listening to conversations, in listening to all the things that are around you. You focus on what is pleasant, what is positive. So there may be a lot of noise around you. There may be a lot of wrong information, a lot of distressful information or things happening around you, people telling you a lot of distasteful things. But in mindful hearing, you choose what to hear, what will keep you in the present moment and give you a certain peace of mind. The things that you are seeing, mindful seeing, as you go about your daily life, you are recognizing and paying attention to things that are pleasant, things that inspire a certain hope in you. So you mind what you see, you mind what you hear, you mind what you touch, you mind what you taste, and what you know you breathe in, you smell, and all that. So mindfulness is very important as a way of handling compassion fatigue. And there are a lot of mindfulness techniques online. We have mindfulness meditation. You can search on YouTube for some of them. Yoga exercises that are tied in with meditation, and all of these help you to live a mindful life, and be able to control your stress levels. You are able to identify when you are stressed out, and you are also able to identify when you are in a relaxed state, and by that you can consciously help your system to deal with stress and keep you always in a state of freshness. So practice mindfulness and other useful breathing exercises. And if you realize that it is getting overboard, the symptoms that we looked at, you want to see a professional psychologist or counselor for help. It's very important. You want to talk to a therapist. Um, Pay the amount that is, needed to keep you mentally sound. It's very important. The same way we buy drugs and go to the pharmacy, go to the hospital and pay bills and all that, it's also important that you make the necessary investment into your mental health. So if it's getting overwhelming, you want to see a psychologist, you want to see a counselor for help. And ultimately, you want to learn to be kind to yourself. You want to learn to be kind to yourself. As you are caring for other people, as you are sensitive to the pain of others, you want to make sure that you are also sensitive to your own pain. You are sensitive to the detriments, that the negative impact that compassion or empathetic living may be having on you, so that you know where the balance is. If we are not able to balance our compassionate, life in terms of professional work that we find ourselves in, the helping professions, or just as someone who is handling or caring for people in a foster home, or as a parent dealing with children, or children dealing with grandparents and all that. If we are not able to learn to balance the whole dynamic, we are not being kind to ourselves. You need to be strong, you need to be healthy, you need to be mentally sound in order to be more and more compassionate to others. And helping, showing compassion, being empathetic is something that should bring us positive sense uh, of satisfaction. We should be satisfied with what we are doing. So if at the end of the day, instead of getting compassion satisfaction, you are getting compassion fatigue, then you need to work on yourself. Be kind to yourself. Learn to be kind to yourself as you are kind to other people. So let's look at the case of Fatima, back to the case of Fatima, and see what she did. So as a result of her realization that she had, or she was experiencing compassion fatigue, having spoken to a mental health counselor, she decided to do a few things, and that would re-highlight the things we spoke about. So as a result of this realization, Fatima began to implement gradual changes in her life. Consciously, she had to make some changes. And she started by ensuring that she got enough and good quality sleep. So after all the day's load of work and all that, cutting what needs to be cut, remember that you are human, as we mentioned. Your compassion, empathetic tank, your sympathetic tank will get full. And so you want to know when to close the tap. You want to know when to stop the flow. She started by ensuring that she had enough good quality sleep. Very important. She improved her diet to eat healthy foods and engage in moderate exercise. Exercising is very important. And I talk about that in mental fatigue. Um, she became intentional in planning her activities with her children that both she and her children will enjoy. So she was intentional with making time for the children, planning activities with them so that she can have time to enjoy with them. And she and her spouse, also ensure that they schedule time together consciously, making time. So notwithstanding the whole load of work you have in as a professional, making time for your spouse and your children consciously and not compromising on those schedules that you are making, because you know that you are also important. You are kind to yourself to know that even as you are caring for others, you also need to care for yourself and your family. Fatima also engaged in a job search because where she was working was taking so much toll on her, and the vicarious experience of stress working with cancer and trauma related issues was too much for her. So she had to look for an alternative job, and she obtained a nursing job in a health facility that was well staffed. So they had enough staff that could support with all the workload. Had reasonable working hours, unlike her previous place, with scheduled rest periods and a positive and collaborative relationship amongst the team members, which is very important to ensure that your stress levels are minimized. As we mentioned earlier, there are a number of factors that can moderate how your work as a compassionate professional, as someone who is working in the helping professions, or just someone who is a carer. There are many factors that could moderate how you are either experiencing compassion satisfaction or compassion fatigue. She felt supported by her new supervisor, who was invested in mentoring her and providing her with opportunities for continued professional growth. Over time, Fatima's physical and emotional symptoms improved. She found herself enjoying her job once again. So she was still in the helping profession, still working in the health system, but now she was enjoying what she was doing because the whole experience of compassion fatigue, the symptoms that she was, having early on, because of the new environment, the new workload, and the conscious effort she made to readjust her life, she saw improvement in her physical and emotional, well-being. And she was enjoying her job once again and feeling especially gratified and fulfilled by her work with the patients. So now she was getting compassion satisfaction from what she was doing rather than being compassionately fatigued or experiencing secondary traumatic stress or vicarious trauma. So the things that we do consciously can help us, that although we still remain as helpers, as carers for family members or people that are going through trauma or are distressed or have a chronic illness, or if you are a veterinary officer, you are dealing with animals that have tumors, and some of them can be really really painful to watch even as you are working on them. And if you're a pet lover, it even makes your case worse. But in all of this, when we make the necessary adjustments and take the necessary steps as we have discussed, it will help you to minimize your chances of compassion fatigue and increase your chances of compassion satisfaction, which is what we really want if we are good people who care for others and ensure that we are always in good shape. And once you enjoy what you are doing and you feel satisfied with what you are doing as a carer, it makes life easier both for you and for the people that you care for. So I hope that what we have discussed in this particular lesson would be useful to us. Whatever you do, whoever you are, I just hope that you pay attention to your mental health, pay attention to issues relating to compassion fatigue, and ensure that you take the necessary steps um, that will not make you vulnerable to suffering or experiencing compassion fatigue. Before you go out, be glad if you subscribe to the channel if you haven't. You like the video, you share it. It helps push this to many other people. Thank you so much. In a different lesson, I'll take us through a test item, the professional quality of life questionnaire, which can be used to assess your compassion, fatigue, or secondary trauma, traumatic stress level, as well as compassion satisfaction and your burnout. I hope to do that anytime from today. Thank you. Stay safe and always remain positive.